somebody's in a position where,
Yeah.
you know, the doctors here are even telling them that you need this surgery right away, or they know that they need the surgery right away, but they are on an 18-month waiting list. You know, what kind of things can they do to, you know, try to take their healthcare into their own hands?
Obviously, you should always advocate on your behalf. So you call them, you ask them for cancellations, you find out, you know, are you on a cancellation list? Can you be called, you know, if there is somebody who drops out, and make sure that you tell them if someone else decides not to do the surgery that you could be called to replace them at a moment's notice, and you'd be happy to do that. So that, I think, is your first order of business. But there's also alternatives that you can look into. You know, unfortunately, if this is going to negatively affect your life and you only have a certain amount of time left, then you need to take matters into your own hand and look at other options. And that's what myself and my family did. My father has had a long-standing back issue. He had 2 prior operations, but he continued to have pain. And the really frustrating part was we couldn't get any answers. And so, you know, they have had the opportunity to travel in the U.S. and had heard different things about people getting minimally invasive surgery in the U.S. Mm-hmm. So we started doing some research about it. And one of the things that was really interesting to me is that when I did research like that in Canada, there doesn't seem to be a lot of uptake of minimally invasive surgery for spine and neck procedures. As far as I know, there's only one place in Ontario that may be doing this kind of work, and when I asked the place in Calgary where all the spine surgeons work out of, I was told that they do procedures that are endoscopic in nature, but they couldn't really definitively tell me what it was that they do. So knowing this, we chose to look at other options, and I looked at things across the U.S., but because Washington was closer, that's why we looked at the Spine Institute Northwest. And what we found out was that they could do an MRI on site. They could provide other diagnostic types of workup like EMG studies, and they could provide rehab and long time, what's the word I'm looking for? Like if my dad needed extra help getting better afterwards, even though they're an outpatient facility, they had a well-rounded plan that they could put in place. As well, Dr. Campson is a specialist in pain medicine, so he understands the whole aspect of chronic pain, and then has the opportunity to diagnose and treat that rather than just providing relief from the pain symptoms with medications. So for us, we decided that we needed to look at other options, because even when approaching the spine surgeons in Calgary, we were still faced with an 18-month wait despite a definitive diagnosis of stenosis. So quite honestly, after 10 years of pain, my dad just wasn't willing to face an 18-month wait. In my heart, I believe it would have killed him.
Wow.
He's 72 now, and he has about 10 years left, so he decided that it was worth it for him to get relief now as opposed to waiting.